Welcome to The Impossible, where we empower others to face the impossible, inspire them to be impossible, and motivate them to do the impossible. I'm Matt, as always, here with my brother Austin Douglas. How you doing today, man?
Fantastic. Hello, everyone.
Good. Guys, we've got an episode we've been waiting a long time to share with you, and we are very excited, and it's awesome how these always seem to line up, but to this week, this time is actually a very special time for our guest who's here today, and we are just very excited to share her story with you, and her, just the person she is so strong and so confident and capable and powerful of a human being, to have battled everything that she has battled in life, to overcome it in the way that she has, and to approach every day with her mindset in the face of such impossible circumstance. Truly is not only just an inspiration and motivation for all of us, but it is also a lesson in how we can face life's challenges, overcome that adversity, and learn and grow and become more confident and capable from it. So without further ado, I want to introduce to you guys Leigh Ann.
You're gonna be crying before it even starts.
Hey, it's your story that's making you do that because of who you are and what you've overcome.
Thank you.
And that's why we're so honored to do everything that we've done, and everything we're able to continue doing is because there are so many stories out there and so many people that are just some of the most phenomenal human beings we could all ever meet. And we're honored to bring all of you guys onto this show and share these stories and who you are with the world. And what's cool about it is that your story is going to help so many people that you may never even meet them, but it is going to help all of those people who are maybe battling through some of the stuff exactly that you've battled through. And not only that, but, caregivers and family members and all of these other people that are impacted by these situations. Your story is going to help them change lives.
And I think that's such a big part of something so special of all of our journeys, that we meet so many people in similar situations yet different, and you form so many bonds with people that you never would have met before, and you inspire them and they inspire you at the same time. It's just you have to kind of turn that journey around and find the positive of it.
Yeah, I agree completely, because that's something we've talked about actually on this show more recently than we had in the past. And it's this idea that we've started using the phrase like, your potential is your responsibility. And I think sometimes some of our statements sound a little like harsh up front, and this might be one of those, but what we mean by that is like, when you go through challenge and you overcome from that and you learn from it and you're able to grow and develop from that, it's like, it is one of the most gratifying things in the world to be able to share that with others and be able to help them through the same thing and make good of all of that hardship you had to endure. So in a way, if you treat like your own potential as your responsibility, like, hey, it was awful that I had to go through this situation, but here we are on the other side, and now I can help other people with that. If you kind of treat it with that mindset, it allows you to approach every day with the thought that, oh, I can make the world a better place from my experiences.
Yeah, and this is what I've learned, and people have helped me through it and shown me, different things that could help me or make my journey easier. Because it's so hard for everybody involved. And I love that statement.
Yeah. Well, we're excited to bring you here, and we're excited to have, just your story available to people. And like I say, especially everyone that we know it's going to be able to help. And we're honored and thankful for you to come on today. And we also want to take a moment before we dive into things. We have a very special guest with us today. Would you like to introduce the star of the show today?
Yes, this is Joseph Allen. We call him Joey. And he is a Cavapoo. He's 7 years old. He's part King Charles Spaniel Cavalier and Poodle. And he's just the best little pup ever. And he's actually my service dog. He was trained several years ago, and he helps me through a lot of things. And he's just the best. I couldn't imagine life without him. So He's pretty great. And obviously, he definitely is the star of the show. He has those human eyes and cute as can be, and everybody loves him anywhere we go, so. Isn't that right, Joe? Are you spoiled?
So yeah, Joey's going to be hanging out with us today, and I'm sure we'll dive into a lot more of the journey with him and how he's been able to help you navigate life and just show people what some of the resources available out there are. But yeah, we're excited to have him here as part of the podcast today.
Yeah.
I do think he knows too. Like he knows how adorable he is.
Oh, he does. Yeah. He plays it up so much. He knows anything from, the stores that give him treats. He remembers that, every time we go to the mall, he wants to go straight to Bath and Body Works and goes straight to their cabinet underneath the things there. That's where they keep their treats, and he'll just go right up there and he'll put his paw up, and he's like, I'll have the treat now.
Oh, that's so funny. Yeah.
Yep. He knows how to work it, don't you, bud?
Oh yeah. But yeah, so take us back to, we always like to start off with just kind of life beforehand and kind of coming into some of the challenges you faced in life, coming into diagnosis. What was life like prior to ever battling cancer, growing up in this area? And then, how did everything change as you were facing your diagnosis for the first time?
I was born and raised in Marietta. I live on a farm that's pretty close to town, but I love that scenario. I love the small town living. You want me to turn it off?
No, if you need to.
I don't need to get it. I just know
cool,
that it's
cool.
I don't know if it's bothering.
No.
My friends and I call it a sparkle when you lose it for a minute.
Yeah.
We'll start that again. I grew up in Marietta. I live on a farm and love that lifestyle. I love just being able to go off my deck and look at the pasture of cattle and creek and everything. And I think it's just a great place to raise my son up in that scenario where you see the value of hard work and the beauty of nature and just all of that. I really love living here, and life was just busy. You in those teenage years where you're running around to all the sports and school and graduations and teaching my son how to drive and working and just coming home and being a housewife, just doing all the things where you don't have downtime. And I think you take that for granted sometimes, that you are so busy that you don't take time out and for yourself. And Joey.
Oh, he's fine. He's not going to hurt anything in there. Yeah.
Pee on something or something, because there's another dog smell in here. Hey, Joe, come here. Stop exploring. Come here. And then we really love to go to Destin, Florida. Love to go fishing. I enjoy going out on the Gulf, getting the big fish, and that's what we did, and a couple times a year. And we had went in September of 2018, and that trip, when we came back from fishing, I came back really not feeling well. I was shaking and cold and hot and sweating at the same time, and I just couldn't kick it, and it was really weird. I was always healthy, never went to the doctor, didn't take a Tylenol for a headache or anything like that, and didn't think anything of it when we came home, just something that happened, weird. And then in December I got this really weird purple rash on my toes, and didn't go away, and went to the dermatologist, and she said, we can do some blood work, see if anything's going on if you want to, or, I can just kind of give you this cream. And I had worked in an older building for an attorney. I did estates for people, estate planning. Love my job, love the relationships you form. I've always been that person that is super close to my grandparents and really held so much respect and love for them. And working with both elderly people and then as well as people that are going through losing somebody. Estates take months and sometimes years to finish, and you just form that relationship. And a lot of times that executor, those family members, they need somebody there to guide them through all of that, and they kind of form some sort of special bond with you because you're the one there getting them through a really hard time in their life. And I just really enjoyed my job and that relationship with people. And but my office was really cold, and so they were like, well, you may have this condition where I forget what it's called actually, where your feet are just getting too cold. Like, take a small heater under your desk at work and, try that. If it doesn't work, come back in a couple weeks and we'll do some blood work. And at that time, I was like, yeah, I don't like needles. I'm good. Let's just try this and see if it works. If I, only know now how many times I've been stuck. But shortly after that, within a couple days, I'm that independent person that's going to carry all the groceries in at once because it's cold outside, and, I'm stubborn. And so I have 2 handfuls of grocery bags, and I was going in the house and my screen door came back and the handle hit me right in the back. And it was kind of sore for a couple of days, and I'm like, just kind of bruised it inside or something. Didn't think anything much of it. And then my husband had a Christmas work party in Columbus, and we went up there for the weekend, and we went to the party, and then we went to Top Golf. I golfed and came in second place. And then we went to the Chinese Lantern Festival up there. Everything was fine. I love them. Yes. I have just like a really, had my big bowl of warm ramen,
That's incredible.
Have you ever had the ramen from those? Oh, God, so good.
Up in Cleveland, yeah.
We did go to the one in Cleveland at the zoo up there, but it was a lot. It was post-cancer, and it was such a bigger walkthrough than the one in Columbus. Oh. So that one, I didn't make it through all of that one. But my son lives up there. So.
Okay, wonderful.
But anyway, so we did all that. Everything was fine. And the next day, we were going to Easton, and my husband was passing a store that we were going to go into, and I was like, oh, you're going to miss the turn. And so he kind of slammed on the brakes and turned real quickly. And when he did that, I just had this enormous pain in my back and just screamed. And, we just kind of stopped the car, sat there, tried to figure out what happened. And I was like, must still just be something from, that handle hitting me in the back. And, of course, he's like, we need to go home right now. And I'm like, the stubborn person that I'm in, I'm like, no, I want this specific thing for somebody from Christmas. I need to go in this store. And he's like, so we went in, and we ended up coming right back out. A few minutes later, I was unable to, kind of continue my shopping spree I had intended that day. So we came home, but I went to work the next day and just kind of heating pad and, took some ibuprofen. And my brother's a nurse practitioner up in Columbus. And so I was bugging him about it. And I think the next day I stayed home from work because the pain had gotten so bad. And then the following day we went to physician's care, and they did an x-ray and said nothing was wrong, and gave me I think prednisone and Toradol. And she said, that you should be feeling so much better in about an hour. And it was first thing in the morning. So about 4:00, when I knew they were getting ready to close, I called and talked to the PA that I had saw there. And I said, it hasn't gotten better, and it's been 8 hours. And so she called me on some lidocaine patches, and they did absolutely nothing. So in the middle of the night, I had to go to the restroom, and my husband came over to help me, and I stood up and I just fell in his arms, and I couldn't walk and just started bawling. And so he's like, that's it, we're going to the hospital. I'm going to call the ambulance. And
what's your, because that had to be like a horrifying experience.
Yeah.
You're just find this healthy person living this normal life, and all of a sudden it seems like it's got to feel like everything's just kind of unraveling, going out of control. Like, what's that moment specifically like where you get up and you can't walk and you fall in his arms? Like, what's going through your head at that point?
Yeah, because, I was 37, and, I hadn't, just like you said, just healthy, and never had back problems. I wasn't at that point where things were starting to ache yet. And, as you get older, and I didn't know what was going on. It was scary and confusing. And I was like, I don't want to go to the hospital, it's just, my back muscles are sore. I just have done something, I'm not going to the hospital. And my son was home from his first semester of college for Christmas break. And so he had just got home, and I was like, I'm not going to scare him by having the ambulance show up. And so I made him, carry me to the car, and, we went straight to the hospital, and I think we just held hands the whole way. I think we were just both trying to process in our head, like, what is happening? And then when we got there, I was in so much pain, and of course, they don't like to give you pain medicine for good reason, but at the same time, I was like, look, I don't take Tylenol. I'm telling you, like, they gave me Toradol. It's doing nothing. This happened, this happened, this happened. So they had given me some Robaxin, which is a muscle relaxer, and that didn't do anything. So they took me back for a CAT scan, and pretty quickly he came back, and he, I'll never forget, he kneeled down beside the bed. So I was looking down at him, and he said, a nurse came in at the same time, and he said, we're going to give you some morphine now. Your L1 has completely collapsed.
And that's a vertebra in your back? Yes.
Yeah. Like kind of like your main area that supports your back is like your L1, L2. And my L1 had just collapsed. And I was like, no, that, in my head, I'm thinking, I just had an x-ray. They told me everything was fine. And he said, but it collapsed because you have cancer. You have something called multiple myeloma, and it's a type of blood cancer in your bone marrow. And it causes lesions. It eats your bones away, and that's why your L1 collapsed. He went on to tell me that I had lesions on other parts of my spine and other areas of my body, but that L1 was so severe in so many, that's what had caused it to collapse. And I just remember looking at him, and it was about 5 o'clock in the morning at that time, and I said, is it treatable, or is there a cure? And he said, there's not a cure, but in a lot of cases it's treatable. And I said, okay, I'll deal with it later, fix my back. And I just remember her giving me morphine, and for the first time in a few days, that was the first time I've ever had morphine, and I could just feel it going through every vein, and I just had that short amount of time, because it didn't last very long, that I just had a moment of feeling okay again. But then having to call and tell people what I had just learned. And I couldn't call my mom. I couldn't bring myself to do that to her were really close, and I just knew that it would devastate her. Her husband, my stepdad, Al, he had squamous cell carcinoma, stage 4, a few years prior. And, now I had it. I had cancer. And I didn't want to do that to her. I couldn't bring myself to do it. So I called my brother, and he said, get to Columbus. Get to OSU now, or Riverside now, I'm sorry. And so he said, I'll meet you there. And so my husband called my mom, and in the meantime, Al had shown up, so he was there. And so it was just that process of having to call, and it wasn't real. You were kind of in shock and trying to process what you were just told. But at the same time, I was so focused on my back, like, so he's got to fix this because I can't deal with this pain, that it just, I don't know. It was jarring for sure. But at the same time, you're in kind of a weird denial phase. I don't know if you guys had that similar experience where it's just like, that's not real.
Yeah, I think it's actually something that we hear everybody talk about, that state of shock that you go through.
Yeah.
And it's like mind numbing, because you would expect like tears, you would expect to feel heartbroken, you would expect to feel sad, you'd expect to feel all of these things. But I think what we hear, certainly all those come at some point and you deal with those later, but I think at first, initially, the number one thing we hear, and what I know a lot of us we both experienced, is just that state of shock.
Yeah.
You just can't hardly interpret. And it's interesting that in your case too, you had this like perspective of like, okay, I'll deal with that later, I need my back fixed. And in a way that might have almost been a little bit helpful for your brain at the time, because you had like a more pressing problem of like just something to focus on. At the very least, there was something else there you could latch on to focus on, because that shock can last for a really long time, and it can eat at you, and it can be very difficult to deal with. So it was in that same ER appointment then that is that correct, that you go in because your back's hurting so much, you get told that you have cancer, and then you get the morphine to relieve the back pain, but then you're kind of off on this journey like immediately.
Yeah, like there's no time, like which I think is good, because I've heard so many stories where just the sole amount of testing and insurance approvals and all of that can just take weeks upon weeks to get through. And that's the worst part of this journey, I think, is waiting for your test results. And you're always refreshing your apps, just waiting to see what your numbers are going to be this week, or what your PET scan's going to say this time. And when you get sent through the ER like that, it's you don't have that sort of insurance waiting game and all of that necessarily. But I had never heard of multiple myeloma ever, so I had no idea, really outcomes and what I was about to go through and anything about it. And then once I got to Riverside, my brother was waiting there with a smiley face balloon and a stuffed puppy that looked like Joey. And they told me right off the bat, they thought that diagnosis was wrong. They didn't think it was cancer. They thought it was, I think they're called hematomas, maybe, like blood clot vessel situations. And I was too young. I was healthy. I wasn't anemic. I didn't have any of the other myeloma symptoms. And of course it was a week before Christmas. Well, I think it was about 5 days before Christmas. the whole initial thing was getting my back fixed, but I had so many lesions that they didn't know what kind of surgery would hold. And they decided on a vertebroplasty, which is similar to a kyphoplasty, but a little different. And they pretty much just went in and injected some cement in there for the time being. But it took several days to get me to that point, because every time they would try to take me, I would spike a fever. And so they wouldn't do the surgery. And I remember the day, I don't remember, but because I was under a lot of drugs. But I have been told that when they actually decided to do the surgery, my mom was on her way up they came up every day, my mom and son and my mom's husband, Al, drove up every day, and they took the wrong turn. And so they were late, and she kept calling my husband, Sean, and saying, stall them, I can't let her go into surgery. And right when they were wheeling me out down the hallway, my mom stepped off the elevator, and she ran over to the, gurney that was pulling me away, and she kissed me, and she said, "I love you, you're my favorite." Because my brother and I have this, who's the favorite, right? And, so I just picture her just like having that moment, running off the elevator as it's like a movie moment, I guess. And, her and Al and Caleb and my dad was there, and my brother and his wife. And, you talk about your journey, but I think sometimes that their journey is so much harder, that they have to go through that and, wait for you to come out and hope that everything goes well. And I have I didn't go through that whole 10 days because I was drugged up. They experienced my diagnosis and hearing it over and over again, and waiting. And my husband is a researcher, so he didn't leave the hospital once. He stayed there and slept on that little hospital couch the whole time. My brother lives in Columbus, so he tried to get him to leave and go shower and sleep in a bed for a little bit, and he just refused, and he just nonstop researched everything about it. And what he found was multiple myeloma. It's a blood cancer, but it's so individualized. There is no two cases alike. You have so many different different markers and different getting to a pause point, sorry.
No, you're fine.
Some are, more aggressive than others. Nobody has, the same treatment a lot of times, or because it's so individualized. And I remember, I think about, because it was over Christmas, it took a lot longer for my bone marrow biopsy to come back. And I finally, I think it was the day after Christmas, and the doctor who had initially told me, she didn't think, she was 99% sure I didn't have cancer. She came in and she brought me a Christmas cactus, and she was crying, and she said, "I'm so sorry. I told you that you didn't have cancer, but your bone marrow biopsy came back," and I did. And she went, it was time for my MRI, I think, and she came down with me, and she held my hand until I had to go. Well, I was in the waiting area until I had to go back there, and she was just so upset that she had given me hope and then had to take that away. But you don't find a lot of doctors that care that much. So she came and told me that, and then the oncologist came in after that, and kind of said that the reason it was so hard to diagnose me is because, number one, multiple myeloma is mostly found in men over 65, 70. Primarily, it's more African American. And then here I am, this healthy, white, 37-year-old woman. And, and they have something called a M spike, which is a monoclonal protein spike. I didn't have that. I have something called non-secretory myeloma. So I don't have that marker to watch. Which at first I was like, I wish I had that, because it's so hard that I just have this one number, which is called kappa light chain. That's the kind I have. But because I'm non-secretory, I don't have that other marker. And my doctors always tell me that's a good thing, that you don't have that, because that makes your treatment harder. The only way to kind of monitor exactly what's going on is a bone marrow biopsy, which aren't fun, for people that don't know what that is. It's a drill into your hip.
A hand drill.
Drill, yeah. And, I just remember that, this last time I had it a couple months ago again, and they said, just think of it as, you're getting a filling at the dentist. And I'm like, that's not really a good way to look at it.
That doesn't help.
But that's just what you hear, and I was like, I hate the dentist.
Yeah. Oh my gosh. Have any of those people that told you that, have they ever had one? It's like, oh man.
It's like, maybe try to think of something more pleasant than a filling at the dentist. I'm not quite sure so many people really think of that in a positive light, but
if you put it that way, it sounds like a good time.
Your attempt is very poor.
And this last time when I had it, they actually the pharmacy or whatever it is, they didn't see the order to send it off for my MRD test. I don't know if you get those or not, minimal residual disease, to kind of see like exactly what your percentage is in it, and they forgot to send that off. And then by the time my doctor realized that happened, it was too old of a sample to be able to run it now, unless I wanted to get it again to know exactly. I was like, I'm just going to roll with the PET scan and the cytogenics that we got from the bone marrow biopsy. I think I can wait for the MRD until next year. I'm good, thanks.
Another one.
Yeah.
No, thank you.
I'll pass. Thanks so much. And I had just had we'll get into that, but I had just had my back surgery a month earlier. So I was like,
oh my gosh.
I've had my fill, thanks.
Yeah, I need a little break for sure. So you go to the ER, you get, for your back initially, you get this initial diagnosis of, hey, and they even knew that it was it's suspected that it was multiple myeloma, which isn't always the case in an ER diagnosis. Most times I feel like you go to the ER and they say, well, we're not sure, could be cancer, but we're going to send you to somebody who knows. It sounds like they were pretty confident up front that they thought it was multiple myeloma. So you go to a bigger hospital in a bigger city, and work with some specialists there who say, well, we actually maybe think it might be something else. We don't think this is multiple myeloma, because you don't look like the typical multiple myeloma patient. I guess is kind of what their thoughts were from, just your demographics, as well as your blood work profile, as well as many other things. They're thinking this is possibly something else. Then you go through the surgery, you go through bone marrow biopsy, you could go through all the advanced testing, and they come back and say that yes, it actually is non-secretory multiple myeloma. So now you have this final diagnosis, and you're still up in Columbus at this point, correct?
Yeah.
Okay. And then you've got your, a lot of your close family up there with you. What are you guys thinking? What are you going through? What's your thoughts, feelings, emotions? What's that time period like right after like official diagnosis?
When my bone marrow biopsy came back, my bone marrow was 60 to 70% myeloma instead of healthy cells. And, you have something called a FISH panel, which tells you which chromosomes were duplicated, deleted, which ones you only have one instead of two, or, things like that. And that's your genetics that kind of determines if you're high risk, standard risk, where you're at in that. And mine was kind of right in the middle of the road. So it wasn't, kind of what they call smoldering myeloma, which can start many, many years before, and you don't have any idea that that's kind of brewing inside. Which, on a side note, they actually did this, I think it's Iceland, might have been Greenland, but I think it's Iceland, where they tried to get everybody in the country to do this massive, largest myeloma trial they've ever done, where they have pre-screened everybody from smoldering myeloma to try to treat them then when it's insanely early, then it, metastasizing years down the road, which is pretty incredible. But anyway, mine was kind of the middle of the road, normal, standard risk. And I just remember when that oncologist came in and he sat there by my husband and I's side and said, this is what's happening. This is what took us so long to make a diagnosis, and this is going to be your treatment plan, which consisted at that time, I think they said 5 or 6 cycles of 3 weeks on, 1 week off of something called dexamethasone, which was a high dose steroid, which you take 10 pills at a time, and, don't sleep for a couple days, and then you crash off of it after that for a couple days. But it makes you feel better. So at that couple of days, so it's kind of a love-hate relationship with that one, I think. And Valcade, which was a shot in my stomach, and then Revlimid, which is lenalidomide, which is a derivative off of a nausea medicine that they used to give to pregnant women back in the 60s and 70s, I think.
Oh my gosh, I didn't even know that.
Yeah.
Oh, it's related to thalidomide, isn't it?
Yes.
Yeah.
Yeah. And it caused so many birth defects that, they took that quickly off the market.
Yeah, because we'll actually use thalidomide still today in rare cases, but thalidomide itself, we'll use it as chemotherapy for multiple myeloma.
Yeah.
And what's wild about that is, like you say, back a few decades ago, that was like the mainstay nausea vomiting treatment for pregnant women.
Yeah.
It's just wild how medicine can evolve. But all three of those are actually a form of chemotherapy received then. It's a steroid, the dexamethasone, but it's at a dose so high that it's what we call a chemotherapeutic dose.
Yeah.
And then same with the Velcade is a chemotherapeutic agent specific to multiple myeloma, and as well as the Revlimid also works in that manner.
Yeah. So I was, and the Revlimid that I was taking was at a pill dose level. So I would have, just my treatment would be pills and shots. So at the time, I was relieved that I wasn't going to have a port. I was scared of the port. I have good veins as far as when I needed IVs, but I was relieved that I wasn't going to have to go in there and sit for 8 hours getting some nasty infusion that was going to make me really sick. And one of my first questions is, am I going to lose my hair? And they said, at that time, told me no. So I was relieved for that. But, as the doctor sat there and very patiently answered all of our questions and went through everything I was going to go through, he left, and right after he walked out the door, my husband just grabbed me in bed, and at that moment was the time it became real. We just held each other, and we both just bawled, and had that moment. And he looked me straight in the eye and said, you're going to make it through this. We're going to make it through together, and you're going to fight as hard as you can, because you're the love of my life and I can't lose you. And, during that moment, a nurse walked in to take my blood pressure and my vital blood pressure, temperature, and she was standing at the door listening to the oncologist, and, could hear that whole situation. And she walked in and was like, I need to take your blood pressure. And my husband is super protective, and he was furious, and he just looked at her and backed her out that door and was like, how dare you come in right now, and knowing that, she was just told this, and we were having, this realization, she can go 10 minutes without her blood pressure, and, backed her out the door real quick. But, so I think that was the moment that I was finally coherent enough, after my back surgery. My incision at that time for that, it was so small. Because they just inject kind of cement in you through a shot sort of thing. We even questioned if I even had surgery, but just doing that relieved so much pain that I was finally starting to come back. But my whole family had went through that. My brother, a nurse practitioner, and, whether it be denial or, kind of along the same lines as them from the start, he didn't think, this is a wrong diagnosis. This isn't right. And so, for them to kind of have to, and especially for my mom, it was really hard on them. Like I said, I feel like I hate using the word PTSD, because I have so much military respect, and
I understand what you mean when you say that.
But I feel like I didn't experience my diagnosis, and I feel like I'm missing that part. My family to this day will not talk about it. When my husband won't talk about it, my mom, my dad, my brother will talk about it a little bit, but I think he's kind of has lived through so much in the medical world and seen so much that it's slightly different for him. But when I try to talk about it and get information from that time, it's just something that they will not relive. So I feel like I'm missing that. And that's something I've tried to work through, but I still feel that. It sounds weird, but...
No, I understand 100% what you mean. And I get what you're coming from too. It's like, it's hard to throw the word PTSD onto it, because like you say, we have so much inherent respect for the military, and that's something that they go through a lot. But I think trauma can be something that pops up many, many, many different forms.
Yeah.
It can take many ugly shapes and sizes and come from many different sources. And so it doesn't make the trauma that you experienced any less, certainly. And it can still be something that can cause struggle and challenges many, many years removed from the initial point of contact, I guess you could say, for lack of a better term. That was something I battled with for a very long time. Afterwards, it was that piece of like, I felt like I shouldn't have been traumatized.
Yeah.
That kept me from dealing with it, kept me from acknowledging it, and made it to a point that I just kind of kept sweeping it under the rug and hiding it up with so many negative means and approaches. But I do think that we see a lot of cancer patients, people who have battled cancer that have, some level of trauma, from whether it's at the diagnosis or whether it's from the treatment itself or whether it's from different surgeries they experienced. I think it's likely more common than not. And it can be really hard to battle because sometimes, like you say, there's people in your life who you trust and love the most that they don't want to talk about it. They can't relive it, and to no fault of them at all, because it would be a nearly impossible thing to relive. But it does make it sometimes difficult to battle on your own. So do you think that that's something you're still battling with today, and a challenge? Joey's re-entered the room. Do you think that that's something you're still battling with today, or a challenge that you're still facing, or is it something that through different methods or means you've learned to work with and overcome as time's gone on?
I think I've worked through it. I think, and I know we'll get into this later. I think when I'm so independent, and I've always had that stubbornness, as I can do everything on my own. I don't need help. And when I wrote my book and I started hearing from so many patients who lived that I'm fine, don't need any help sort of life, and you couldn't tell people what you're really going through, I think that really helped me through all of that feeling that I was going through of, just trying to figure it all out and my place in the world. And so yeah, I think there will always be a part of me that is missing, because I didn't have, I had the ER experience, and I had that last day experience with my husband. But anything in between that, I still just I'm missing. But it's 5 years ago, and it was a chapter. It happened, and there's been so much that's happened in between, and a lot of it just kind of makes that seem not as important.
Yeah, and that's how cancer journeys can go. It's can be one challenge after another, and just when you think it can't get any worse, it can. And sometimes it does. And that may be due to treatment. Again, it may be due to setbacks. It may be due to recurrences. It may be due to so many different factors. But it's a constantly moving, constantly shifting challenge and battle and process. Mm-hmm. So you go through your diagnosis process. You get on your initial treatment, which was, you said, steroid, as well as a couple chemotherapeutic agents. And then you go on to continue that battle, continue that process. How long were you on that initial form of therapy, and where did that lead, and what ended up coming next from that?
I was supposed to be on for 5 or 6 cycles initially, and my body reacted so quickly to it that I only ended up being on 4 cycles. So I ended up starting before I left the hospital. So I had that time with my husband, and then the next morning they gave me my first shot of Velcade. Revlimid takes a really long time to get insurance approval. So it was actually, I don't think I started that till actually my second cycle. It took that many weeks to get approved. And then I was discharged same day. They gave me the shot, discharged me, and that was my first one. And at that time, Dr. Colley wasn't taking patients because, she's incredible and she's so many patients.
Sure, sees more patients than anybody could even comprehend how
Yeah.
she can do it. Yeah.
I was familiar with her just by word of mouth, because you hear so many great things about her in our area. But my husband had also went to school with her and played tennis with her. And so he had known her as well. When the oncologist was talking about her, and he said that he used to work with her when she worked up at Ohio State, and they were good friends. And so he had called and said, I have this patient, she's young, I'd really like you to try to fit her in. And so of course she did. And thankfully, because I don't know, honestly, I tell her this all the time, I don't know where I would be in my journey if I didn't have her support.
Austin and I feel the same way. And so many of our other guests who have been treated by her and given just the highest level of care by her, I think we all feel that. Anybody who's ever encountered Dr. Colley, whether a patient, coworker, family member, whatever else, I think we all feel that way for sure.
Yeah, she is remarkable. But, at the same time, when you go to Strecker, she expects that from everybody else. So you have that sort of, I think, family mentality that you grow there because you become friendly with your nurses that you see every week. And, like Marcia, my nurse practitioner, she's, fantastic. And I think that they all learn to care about you because, they're compassionate and patient and they're treating you every day, and they see loss every day of these people that they come to know and become friendly with. And I just hold them all in such high regard to just have to watch that and come back every day and just have that heart to do something like that. But so I saw her on New Year's Eve. I think I got discharged on December 27th or 28th, maybe, somewhere around there. And I saw her a few days later on New Year's Eve and got my second Velcade shot right away. And I just remember her coming in and kneeling down on the floor so she could be eye to eye with me. And she has, as we all know, carries this clipboard of copy paper around with her. And thankfully, because as you go on and your chemo brain begins, you have those drawings and notes that she lays out for you. And, you have that to go back when you can't remember what she said to do or what she said, this specific thing is what this is going to help, or this is where your lesions are or whatnot. And, you have those drawings from her, which are just incredible. And, I just, she knelt on the floor for, 20, 30 minutes and went through every single test and drawing. And so I would understand. And she said, I'm not worried. You've got this. You're young. We're going to get you through it. I've got faith that this is, going to work for you. And so after that, like I said, thankfully didn't have to go in for IV infusions, but I did have to go in twice a week for my Velcade injections. And so they'd start at, one corner of your belly and, just kind of make that circle so you're not going over and over in the same spot. But, you get these big welts, you just have these 4 patches of purple bruises everywhere, depending on what nurse you had and who warmed it up and did it slow and who just jabbed you in, how big your bruise was or how much it hurt. But, you just go in, wait for your labs. And luckily through that whole time, I didn't have the throwing up a lot of people get when they get chemo. I didn't lose my hair, so I kind of went through, I'm a people pleaser, I'm a giver rather than a receiver. I love just making people happy. And I didn't want, I was trying to put that I'm fine, brave face on so that my, especially, like I said, my son was home for his first year of college, and he would come home. His schedule was Monday through Thursday, so he would come home Thursday night every week, and he would go back Sunday night every week. And I felt so much guilt for that, because it was his first year of college, and here he was coming home because I was sick. And I tried to tell him, enjoy it, go out and do whatever it is that you college kids do your first year of college. Like, I don't want you to look back and remember that your first year of college was spent taking care of your mom. And I still, that's one thing that I haven't quite worked through. He swears he doesn't feel that way, but that's something that, he's still my baby. He's 24 years old, and I hated that. I feel like I ruined his first year of college. But happy to have him home, but happy to see him every weekend. But, so my intent was to, not portray how I felt, physically and whatnot as much as I could in front of him, and stay positive, because I think that if you don't stay positive, you can go to a really dark place. And I kind of I knew my path. I do better if I have, lists and schedules and different things like that. So I had initially 5 cycles or 6, and it got taken down to 4. And so once every cycle was done, I had a week off, and, to kind of recoup a little bit. And 1 cycle was down, and then 2, and then, they took 1 down. And so by the end of 4 cycles, you ring the bell, which is great, but that your cancer doesn't have a cure. So you're ringing that bell because you're done with your chemo cycles, but not really, because you're going to go to these other things, and then you're going to live on everyday chemo for, the rest of your life or until cure. But you go through that process and have that moment, and then and then I had 2 days in Ohio State where you do nothing except 8 to 4 testing for 2 days in a row, every possible test. They took 27 tubes of blood. You do bone marrow biopsies and check your veins and all the things. And that followed with, they call a stem cell harvest, which was in preparation for a stem cell transplant. And it's pretty incredible, the machine that they have, and just medical equipment that's out there. So I had 2 steel needles, and 1 in each arm, and you can't move for 6 hours. So, if you have to go to the bathroom, you're out of luck. You can't move. So I remember that morning, I'm like, I'm not drinking anything because, but, then you said, and they, I think, I can't remember the exact number, but I think it was like 9.8 million stem cells that they took out of me, go through this machine, collect them in the machine, and then put blood back into me. And so we did that. And then on my birthday, which is April 3rd, was my stem cell harvest. So that's how I enjoyed that day that year. And then on April 15th, I checked into the James for my stem cell transplant. Which that's when they don't tell you lose your hair, which at the time I was so distraught about, too focused on. I look back now and I'm thinking, man, that was so easy to not have hair. And some days I wish I would have handled that situation so differently now. But at the time I was just like, it was more important than it ever needed to be. Well, I think it's kind of one of those things that dichotomy is just so unique, and it's so interesting. It could be funny looking back on it, obviously not at the time, but it's like
I think a lot of cancer patients, again, a lot of us share that kind of perspective on it, that, you know, there's this one piece of it that it is so hard to go through, so hard to navigate, so hard to deal with. And I think the reason for that is because that is the ultimate visual representation, the visual confirmation that you are battling cancer. Mm-hmm. Because when you're outside of the world of cancer, like, that is the kind of defining feature. You know, you see it in all the TV shows, you see it on TV, you see it, you know, people with no hair, like, that's kind of like, and throwing up, like, that's kind of the two big hallmarks of a cancer patient, I think, online. And then when you are approached with that the first time, you see yourself put on that kind of hallmark feature, or I guess, you know, you lose your hair, and it's like you are living that kind of hallmark feature.
Yeah. I
think it's just another one of those pieces of, like, reality kind of setting in, like, this is the world I'm in now. And that rightfully so is an impossible thing to face.
Mm-hmm.
It was like collecting beard hairs out of the shower. That was the biggest part, because Matt was shaving my head, or buzzing my head, in preparation for everything, and I was like, oh, that's fine. Mm-hmm. That's fine. But then the beard started coming out, and that was the rough part. Yeah. Honestly, the rough part.
Yeah. You've grown a lot back now.
It came back, and it stayed back after the CAR T cells. So I'm just, it's...
Yeah.
Yeah.
Well, I think that once I had cut my hair off real short before I went in, and once I had, so on day one, on check-in day, they put your, it's kind of like a port, but I think it's called like a external catheter. Is that what it's called? In your chest, you know, you have to go down, and, you know, they're supposed to put you in twilight, and, you know, I'm a lightweight when it comes to medicine, and, you know, so usually it doesn't take that much to get me knocked out, but they, you know, I just remember this doctor, he's behind me and he's over top of me, and looking up at him and going, should I still be awake, like functional here? And so he told the nurse to give me more, and I'm like, I'm still here. Like, you know, and so they did it a third time, and finally he just, you know, put some lidocaine on there, and, you know, because I was still awake, and then I went back to my room, and they gave me through my IV, or through my new catheter, something called melphalan, which is a nasty chemo, but it just kills everything inside, and it drops your immune system down to zero, your white blood count down to zero, and so you're in this, you know, specialized, sterilized room that's sterilized several times a day, and, you know, nobody can come in without those duck masks, and which, again, I've got to give it to my husband. He wore that mask and slept in there for 2 weeks, and never left, and I'm sure that was incredibly, maybe a little more difficult than my experience at the time, because keeping those masks on for a long time is pretty terrible. But you have to, that particular chemo is so toxic that it fills your mouth with mouth sores. And so to try to combat that, they've found that if you suck on ice, it sometimes keeps that away. And so they have you suck on as much ice cubes as you can for an hour before they give you it. And I did great. I was like, I don't want mouth sores. Like, I'm fussy if I get a cold sore, you know, I don't want a mouthful of mouth spores. It's gonna be awful. So I had, you know, I just told my husband, keep giving me, fill my mouth as much as you can, and I'd hold it in there. Ended up getting a little bit of, you know, something similar to frostbite in my mouth. It wasn't really thrush, it was frostbite, but it was kind of similar. I would say take this different medicine for it, but regardless, I didn't get cold sore or the mouth sores, so I'll take it. So you have all that chemo, and then your transplant's actually 2 days later. So that was April 17th, and it's pretty, nothing climactic. They just put the bag on your pole there and, put it in there. But they make it a big day. They bring up cheesecake and cards that say Happy Transplant Day and everything, which they tell you will, bring something to do because it won't take effect for a few days. All of the side effects are in bottoming out and everything. Well, at about midnight that first night, I got really sick, started throwing up and passing out. Well, what had happened is the fentanyl that I wasn't getting got stuck in my IV. And so it all released at once from putting the catheter in. And I kept passing out. I wasn't functional. And so from that, I was actually sick for a few days. So I didn't get you're going to be fine, bring something to do for a few days.
I wondered when you said that, I was like, they're giving you more fentanyl? And it's still not doing, I don't know. In my brain, that triggers okay, something's not going right here because that's not a drug that you just keep giving more of and people are fine. That's a drug. That is a very, very, that's our highest power opioid available. And it does not take a lot to do a lot. So the fact that, okay, that makes more sense then. It's just, man, it's unfortunate that they weren't able to catch that sooner. And,
and I'm, 120 pounds. And like I said, I was never a person to take, even Tylenol, and so I'm pretty much a lightweight. Yeah,
we will see that people have genetic variances and some people need a higher dose, some people need a lower dose. But by the third administration of it, you should have felt something at least. I would have thought. So it's, oh man, that's unfortunate. And you're, I guess, a little bit fortunate that could have been a very dangerous situation too, because fentanyl overdose is, we see now so much can be a very devastating thing,
Yeah. And, and again, I think you go back to the people who surround you, and my husband having to go through that moment where, I was not coherent and not functional, and they couldn't get me to stay awake. And I was, when I was throwing up, and, I had just had all that chemo and, at the same time. And so that was a process. But, it's they tell you that it's awful. Stem cell transplants are terrible. And, it wasn't fun. Yeah, I'm not going to lie. It was not a fun experience. But they gave me Ativan every day. And like I said, I'm a lightweight, so I was pretty out of it, except, they make you get up and shower every day. And that was the part I hated the most about it, because, you got to put that saran wrap thing on you and cover all your cords up, and you don't feel good. And, it causes you to, get rid of everything in your body, and the nurses have to watch you and then check it to make sure you don't have C. diff, and, have to deal with that during the transplant. So you have somebody watching you go to the bathroom, and then a nurse showering you. So all of your privacy is just gone. But, I got through it, and, my husband and I, to this day, he calls it, the best birthday, because that's the birthday that saved me and gave him back to me, or to him, gave me back to him. Yeah. And so we celebrate that day every year so well. And I either dye my hair burgundy, because that's my cancer ribbon color, to celebrate it. And, or, I kind of got lazy last year and wore a burgundy wig, because my hair's a lot longer now. And it's really hard to get, dye blonde hair burgundy. But that is one thing. When I lost my hair, they said it would come back curlier, thicker, and darker. And I've always had blonde hair, and it came back dark brown as dark brown could be, super thick, but not curlier. And that's the one I wanted, because I've always had this kind of stringy, wavy hair. And I was like, oh man, it'd be so nice to just, dry it and put some product in and go, and not have to deal with half straight, half curly. And that's the one I didn't came back. It came back exactly the texture it was before, except a lot thicker and a lot darker. So now I have to, dye it quite a bit more, but yeah.
And we recently, you say you celebrate that kind of like second birthday every year. Recently had a pretty exciting one of those, right?
Yep.
You want to tell everybody a little bit about that?
Yeah. So this was my 5th year, my 5-year transplant. They call it a rebirthday. And so we had a big celebration, and just to share that part of my journey and accomplishment, because last year I lost a good friend of mine to multiple myeloma, and she was only diagnosed 2 weeks before me, but she had a very high risk strand, and she didn't make it as far as I did. And, I think you kind of sometimes go through that survivor's guilt, like we're on the same journey. She's got an 8-year-old daughter. Why her? I just lost another friend a couple months ago, Missy Arnold. And, in one way, when I very first met her was, I had kind of, acquaintance with her, I guess. But then, we became friends. She was really looking for a cancer friend. And we had started talking. And a couple years ago, I was like, come to Relay for Life with us. Like, I have this group of cancer friends. And, like, I didn't know my life needed them. Come meet them. And she's like, I can't, because I'm terminal and I'm not a survivor. And I said, you are a survivor. You have 3 young kids. You're not gone yet. You're fighting every day. You're still here. Come with us. And she did. And we sat in a group of 6 of us in a circle of chairs and talked about everything that nobody else talks about, nobody else understands, but we all do. Some of us have the same cancer, some of us have different, but you all sort of go through that similar journey regardless, and understand what the other one's going through. And I remember when she got home that night, she was a different person. I think she was so grateful and needing that camaraderie, I think. And, we talked about what we go through and can share with other people, and we learn. And when she was having radiation and going to lose her hair, she was so upset about it. And we told her, look, we've all been there, but I'm telling you right now, it's not a big deal. It isn't nearly, don't stress about it. Stress about something else, because it's just not a thing, I promise. And as soon as her shaved her head off, or her hair off, her head, she texted us in our group chat and said, you're so right. Like, I'm so glad that I have you guys, because it's just not a thing. Actually, it was freeing. I didn't realize how much, the damage to your hair and the coarseness and the itching that all of your treatment brings, getting that all off was actually a weight, lifted off. So I think that that's something that, that you stress so much about, that you could share with somebody to kind of hopefully relieve their fear of that. But anyway, I got sidetracked on what your question was.
No, I'm glad you did, because you brought up a point that that is so foundational to what we talk about. We brought this up before, and we'll continue to always bring it up. It's this idea that, you know, there's an idea out there that, like, you can define the meaning of life as becoming the person you needed in your darkest hour, and giving that to the world, giving that to those who need it.
Yeah.
And that's kind of what you were able to do. You were able to be that person that you needed. Like when you in your darkest hour, you're able to be that for somebody else.
Yeah.
And you were able, in that way, in doing so, you were able to help give her newfound perspective, newfound appreciation, and a newfound strength and confidence for what she was going through.
Mm-hmm.
And that, I think, is the highest calling that we could all ever fulfill. Yeah. And I love that you bring up that story and saying that, and explaining to her, you know, survivor is not necessarily, it's not a title you earn when you've gotten to a certain point. A survivor is somebody who fights on every single day through the challenge.
Yeah.
And whether you reach a cure or you're terminal or you're in remission, that is not relevant to the term.
Yeah.
A survivor is someone who fights. Survivor is someone who lives on through the challenge, through the adversity, through the impossible, and continues to live and fight in the face of that every single day.
Yeah.
And that's why our main term is be impossible. Because it's not something that begins and ends. It's something you do every day.
Yeah.
Through the face of your greatest challenge. And I think it sounds like you were able to give her that perspective when she needed it most. And
yeah. And she was, you know, she fought so hard every day, especially for those, you know, 3 young kiddos who are remarkable in themselves. And, you know, at the same time, you know, she, you know, her charity and, you know, collecting, you know, she's going through all this battle and literally, you know, preparing, you know, to leave this earth, and, you know, collecting things for, you know, schools or I can't remember, it's Angel something, it's for women's shelters and stuff like that. And, you know, through all of this, you know, shortly before she passed, you know, it was just always thinking about others. And I will forever remember that night, because it was just such a, I think, a relief for so much of us just to have that, you know, time where, you know, our husbands are just all sitting over there. We're, you know, having this moment. But thankfully, a lot of us are blessed with incredible husbands that are just take care of us and live for us and would do anything for us. And I'm really thankful and blessed with that. But going back to the transplant birthday, my husband and I really love this song called I Believe in You by J.J. Heller. And the video itself is this husband and wife who, she doesn't have cancer, but she has this, I can't remember what she has, but this terrible disease that really impacts their life. And it's all about him taking care of her and, you know, telling her, I believe in you and you can do this and I need you. And so that's kind of our, you know, song, I guess, for this situation. And so I got this tattoo that's my husband's writing. It says, I believe in you. And it has my transplant date of April 17th, 2019. And every year on my transplant birthday, I get another one, another little butterfly. And Marcia and Dr. Colley always say that, my whole arm's going to be full because that's how I'm going to live. But this year, since it was the 5th year, I wanted to do something more special. And so the 5th butterfly is a little bit bigger. I just got it, so it's not quite healed yet. But and then I got this bigger, loose, strong butterfly. And so I think, when you kind of have those moments, I have that to kind of look, and one, I have that moment for my husband, and two, visually reminds me, hey, look, this is how far you've come. Like, you can do this, get over yourself and suck it up. But still, having said that, you go through all of that, and I didn't eat in the hospital because I was so sick, and I had lost, I think it was like 18 pounds by the time I had gotten out. And when you take much dexamethasone, which I had then as well, it just deteriorates your muscles. And my husband said that it just looked like, it's not funny, I guess, but that it would just look like there was water balloons hanging from my legs because my muscle mass just completely deleted. And I was just looked terrible, and I gave up on wigs really early on because, like I said, that in the big picture, how I felt was much more important than what was on my head. And so, I was bald all the time. And like you said, you have that to this day. My family, I don't wear a lot of makeup. And so my family knows what kind of day I'm having by my eyes. If I have, the brown chemo eyes that day underneath, the big brown that gets under there, and, that's how they know. Like, they're familiar enough that I can't fool them anymore, But you have that, like you were talking about, you have that, you're bald and you've lost so much weight, and you just have that appearance, where you look awful, and you look sick. So I had to live in a bubble. I wasn't allowed to be around, real flowers from the bacteria spores that could be on them, and, not eat lunch meat or deli meat or eggs, or, there were so many rules coming out of transplant that you couldn't do. And I had to kind of live in a bubble for 100 days. And after that 100 days, I didn't have any chemo during that time. But after that, I got put on maintenance Revlimid, which is every single day. It was 10 milligrams instead of 25. But that was the time in my life, that was the darkest time, I think, since diagnosis, because I had such milestones that I, set up to get through. Okay, check this off. And now it was like, okay, well, this is my life. Like, these are my days. This is my side effects I'm going to have every day. Like, this is it. Like, chemo every day, no milestones. Like, this is just my life. And I couldn't deal with it. I got very depressed, and, it was a dark time. And, hi, hello. Thank you for the kisses. Thank you so much. Can I help you? Joey would like some attention. And it was really hard for, my mom lives next door, and she practically moved in with us. She went home to sleep. She'd work and come over after work when she got off at like 1, and then she'd just go home to bed. She lived with us for about a year. Is that okay? Yeah. And
bring it down
for them to watch that, and no matter what they said, helped. And I kind of had to find a way to get through that. And, that's when I think I got introduced to my friend Judy shortly before that, but, just kind of an introduction sort of thing. She also has multiple myeloma, the same type I have, but she never had lesions. She had the kidney situation from it. So I met her, and we became really close instantly and just had that bond. And she's amazing. And she's had all sorts of secondary cancer. Well, she's had, breast cancer, multiple myeloma, and recently lung cancer. And because as we know, our chemos can cause secondary cancers. And it's just, she's incredible. And, to get through all of those. And, but we've had late night crying phone calls, and even though I have a big support system, it's different that she knows exactly where I am and has been there. She's a year ahead of me in her journey with multiple myeloma anyway. And then we, kind of moved on, and with the fashion show, I met Michael and Jerry, and we clicked instantly, and we've been great friends since then. And then, Jerry had a friend, and then, I brought Miss Ann in. So, every day we just have this group chat where we're just constantly, this is happening, please pray for me this today or whatever. And that really, as much as I love and admire my family, I think that really got me through. And I think if everyone who is going through this is able to find, reach out through Strecker or wherever they're getting treatment. And, that's one of the ways I got in touch with Judy. They suggested that she be my mentor. And I think they're great at doing that there. I think you need that in some way in your life, and you don't realize that.
Survivor is somebody who fights through all of life's challenges and adversity and everything you face, through every impossible. You continue on. You be impossible in the face of that impossible. You survive every single day. And regardless of whatever battle comes up that day, or whatever challenge you may face, or whatever good day you may have, or great moment in life, you continue to survive. And you continue to thrive through all of it. And in doing so, you've actually built a whole community of survivors and thrivers around you. And all of you are constantly facing every impossible in life and doing the impossible in spite of it. And it's such a motivation to all of us who are still facing, whether it's still battling cancer or battling the challenges that can come from it later in life. In that way, we're all survivors. And I love that you bring that story about Missy Arnold and all of the friends and mentors and everyone you've encountered, because that is so important. You're not a survivor because your cancer was cured. You're a survivor because you chose to fight every day. And even when it was hard, even in the moments when you break down and you don't feel like you are.
Yeah. And I think that there's so many, to the outside world, as time goes on, we talk about the image you portray when you look sick and you don't have hair. Well, if you have a chemo that you are lucky enough not to lose your hair, or like now I've been on maintenance chemo for nearly 5 years, and thanks to photo filters and different things, when you post pictures and you try to portray yourself as not sick, and you don't look that way, I think people forget what you go through every day, and especially if you don't share it. And that's what I was doing. I don't want people to look at me and think, oh, she looks awful, she looks sick, or be uncomfortable. Because how many times can you ask somebody how you're feeling and, you don't want to tell them, look, this is what I'm doing every day and it's terrible. Like, and just kind of repeat the same thing every day. So it's just like, I'm fine, I'm fine, I'm doing great, I'm fine, And COVID happened. And then, you're immunocompromised because I'm on chemo every day. And so, that's a bigger bubble than I think even, it was new. Everybody was scared, the world's on lockdown. And, I had, I had visitors come and sit outside my screen door. And my best friend, Megan, she would live at my, door and, my family and whatnot. And just to give me some other human interaction. And I have this, I used to sleepwalk and eat Swiss rolls in the middle of the night in the refrigerator. And I would have, friends and family just like porch drop Swiss rolls that they would pick up, because they didn't want me to run out in the middle of the night, and so, and then I think I journaled a lot during that time. And, thankfully I have a really good marriage and an incredible husband. And, I think we just continued to grow during, I think when you are stuck with somebody pretty much 24/7 for years, because I can't leave the house, and, subsequently he has to be so careful when he goes to work, we just talk all the time, and we have that bond and relationship. And I think, COVID destroyed so many relationships of having to be stuck together. And, on top of that stress, you have the stress of everything going on with me, because nothing is easy. I know, my doctors think I'm an anomaly sometimes, because I'll go in and I'll have this issue and, they don't know what it is, or they haven't seen it before. Or, we own a condo in Destin, Florida, and it never fails. The day before we're ready to go on vacation, every single time something happens to me. Last year, literally the day before, I got a blood clot. And I was so upset. I was like, man, she's not going to let me fly, and luckily it was in my arm. And I knew when they wouldn't let me leave the hospital after they did the Doppler thing, that I was going to get a call in a few minutes. And it's, Dr. Colley is just so sincere, and she's like, I'm sorry that this is happening to you, and but it's okay, we're gonna make it happen. And so I had to do some belly shots. She was on it immediately, to make sure I got the Eliquis before I was going to fly out. I still had to do the compression socks and the shots while I was in Florida with the Eliquis and all of that. But I got to go. The time before that, I got shingles the day before, so it's like always something that you're dealing with. And, your cancer markers are up more. And so, they're changing your chemo dosage, or your ANC and your white blood count keep dropping. And so, you have to be, again, super careful. And then also you can't be on chemo if they're that low. So you're off for a little, there's always the roller coaster that is multiple myeloma, as well as other cancers, I'm sure. And it's daunting, and it's so stressful for everybody, me, my husband, my mom, and so on and so forth, that, it's just always like you're holding your breath, waiting for the next thing to happen, or waiting for that test result to come through, or to see where your cancer markers are that month. And, mine have been increased since they started increasing a year after transplant. And so, but also I don't have that other test, so it's just always been this thing. And kind of behind it is I needed another back surgery. And I kind of did put it off because of COVID. I kind of blamed that, well, I can't do a surgery right now, it's during COVID. And then we couldn't find a neurosurgeon around here. We saw so many who said, you need this. but with your lesions and everything else on there, don't know if it's going to hold. And I don't want your whole just spine collapsing. So if the neurosurgeon's not confident, I don't want him touching me. So we were lucky enough to finally, my friend Judy moved to Pittsburgh and started going to UPMC up there. And she said, have you looked up here? And I said, no, I guess I haven't. And so I looked up there, found this incredible neurosurgeon oncologist up there. And we finally did what was supposed to be just fixing. Oh, I'm sorry.
All good. Okay? No, you're all good.
What was supposed to be not a very large surgery, just kind of going in there and fixing that L1 area. A couple months prior, I had fallen on my deck and I had broken both of my tailbones and sliced the top of my T11 right off. And so I had added fuel to the fire by doing that. And so my surgery ended up being T10 through L3. So I have this giant incision. It was something that was supposed to be minor, but they tell you that's not going to be your pain. The incision, your pain's going to be muscle spasms. And it's like, I'm pain tolerant. I deal with pain every day. I'm in pain every day, and I fight taking my, narcotics because I can't take any sort of NSAIDs, and I'm stubborn about taking, I take 23 pills a day. I don't like to add another one to my, but I have never been in more pain in my life than those muscle spasms. I woke up the next morning screaming. It took 7 hours to get it under control, and I was asking to die. I was like, just let me go. I can't. Like, it's so painful, and it was constant. It didn't stop. It was just like a radiating circle of pain, like that would just go right around that area in a circle. And I had my mom, dad, my best friend Megan, and Sean. They were all up there, stayed up there with me for the whole time in Pittsburgh. And I had all at once oxydilaudid, Tylenol, a lidocaine drip, which I didn't even know was a thing, and then a push dilaudid, which was like an extra shot of it, and then ketamine, which I had never had, and it was awful. It gave me terrible hallucinations for days after I stopped taking it, even when I got home. So hopefully I am never given that medication again. However, that was the point. After 7 hours, I kept telling the nurse, I'm so sorry. I'm so pain tolerant. Like I don't know why this is happening. Like, this isn't me. Like, I just suck it up and go on with it. And she was like, it's fine. We see this all the time. She said, usually it's actually the pain tolerant people that we have a hard time getting under control. And, but my parents and, my best friend who, I think I've probably scarred for life after that. But, and my husband, had to sit there and watch that, me scream and cry. And, that's just another example of, I have the utmost respect for our caregivers and those around us who we're lucky to have, because some people don't have that support. I'm due, and I'm grateful for that. But I'm healed and, doing the physical therapy part, which I don't enjoy, but I'm powering through, and it's done and over with, and it was successful, and that's all you can hope for.
Mm-hmm. Yeah. And you're surviving every day, continuing to fight on.
Just got to push on, and kind of take the good days with the bad. And that's another hard thing I think everybody probably has to go through, is you have to take that time to rest and force yourself to just be okay with it, because your body's telling you, they have to repair. Your body isn't the same anymore, and it's not the same as other people. And if your body's telling you have to sleep for 24 hours to recover, then that's what you have to do.
Yeah.
So you go through the surgery. It sounds like you've had significant pain improvements and strength improvements, and you're able to, function much better since the surgery. What's life like now? 5 years from your transplant date, 5 years from some of the darkest times you've had to really battle through. Mm-hmm. What's life like now? What's the day in the life of your survivorship look like today?
I think, there's always the roller coaster. Nothing is ever normal. And on the days that are normal, you kind of have that moment where you have a few good days and you're like, oh man, if only I could go back to, if only every day was like this, and you could go back to normal, and that's the big thing, right? In the beginning they tell you you have to learn that this is your new normal, and I hated that phrase for so long. There's a commercial on TV that says new normal about some sort of pill, and every time it comes on, like I mock it. I'm such a child when it comes on. I'm like, new normal.
I love that.
But like still to this day, every time that commercial comes on, I roll my eyes and mock it. It's ridiculous, but I just hate that term because I think it reminds you that you're not normal, to normal standards or whatnot. But I think you have to make your own routine, and you have to accept that I'm still on chemo all the time. It doesn't go away. It's not going to go away. I'm lucky enough to have been on Revlimid, which is a pill, for the 5 years maintenance. And the problem with myeloma is that it becomes resistant very quickly to one medication, and thankfully there's several myeloma medications out there, but Revlimid is still the one that is the longest lasting, the most successful in treatment. And so you want to stay on that, as long as you can. And it's easier. You're taking a pill, but it also still has the side effects, the bathroom side effects, the fatigue, the joint pain, the and then you also have the residual transplant, and all the treatments and toxins have done to your body over the last 5 years. And I have a hiatal hernia already, and the Revlimid has kind of eaten my GI area away, and so all of the good foods that I like kind of destroy my insides in some way or another, and so I'm constantly dealing with that. And joint pain is a big one, I think. And you can't take anti-inflammatories, or I can't. Tylenol doesn't help that. So you have to learn. I've had to learn to live daily life in pain, and I've tried all the things. Some things work with better than others, whether it's CBD oil, CBD balm. I've tried medical marijuana. I don't love it. I don't like not being in control of my own, I think that is still part of dealing back with when I, wasn't in coherent during diagnosis. And then I'm foggy after that the next day, and you're already fatigued, and I just don't love it. And I don't like taking my narcotics unless I have to. And, you just kind of have to learn to, I'm not a morning person anymore. And I don't know that I ever was, but it takes me a while. It takes a while for my medicine to kick in the morning to kind of get out of bed and function. And I push myself a lot. But But at the same time, my body's gotten to the point where, like after the fashion show last year, I curled my hair, and my non-muscle mass that I don't have anymore hurt so badly that I couldn't lift my arms, and my body was in so much pain. And when my body gets in so much pain and needs to recover, I sleep for days, and it's really annoying because I literally can't wake up. Like, I'll wake up and try to force myself, and it's literally 24, 36 hours where I just sleep nonstop. And Sean will wake me up to go to the bathroom and take my meds or whatever, try to force water down me or whatever, but I can't physically stay awake. And it's that's one reason that I don't work anymore, and I miss that. But nobody's just gonna be like, okay, you had to sleep for a few days, so we'll let you have it off. But then there's days where maybe I'm off chemo for a certain reason, and you kind of feel better, and you have those reminiscent days. And I think the biggest thing is you just have to learn to take the good with the bad. And it took me a long time, several years, to accept that. And, I felt guilty sleeping for days, and my husband just kind of wanders around the house, taking care of me, being kind of bored. And he doesn't see it that way, but, I do. And, if you have good days, embrace them and go out and stand in the sun. And I think sometimes for me that's all I need, just to go outside and like a nice day that we're having now, and just be out there and just take it all in and enjoy it. And so there's more painful days, there's less painful days, there's bed days, there's days that my back hurts still, and my joints, and you're lots of fatigue still, but you just go with it.
Yeah, the I think the same could be said for pretty much anybody with any challenge you face in life, but never really seems that there's this kind of like storybook arc of the the beginning, the middle, the ending, and then everything's over and everything's happily ever after. I don't think we tend to see that in real life, because there's always something to survive. There's always something to fight. Once again, that's why we say we focus a lot more on the be impossible than the do the impossible. Mm-hmm. Because there's all these little milestones along the way where you'll do these impossible things, and there will be these little minor moments of resolution and victory and triumph. But there's always going to be that challenge to overcome, that adversity to face. And, I think if you look at that at face value, it can be like, it can look scary and daunting, but it can actually be an incredibly motivating thing with the right perspective. Like you say, there's good days, there's bad days, there's days. I mean, we still have days that like, we're just like, we can't do this anymore. We don't want to face this. Like, you'll always have those days, and that's okay. That's fine. That's normal. It's all right. If you're having those days, it's all right. But the main piece is that, you let yourself feel those emotions. You let yourself have those days, and then you get back up and you keep surviving and you keep fighting.
Yeah.
And I know for me, that's what's given me so much purpose now, is not just the surviving for myself, but the surviving for my family, and the surviving for the so many others that are battling through the same things right now. And how can I help them and make their lives even better and make their challenges more capable of facing every day. And it sounds kind of like you're doing the exact same thing. Like, you're fighting every day, you're surviving every day. And, you know, like you said, there's good days and there's bad days. But what would you say is one of or some of the main things that keeps you going every day? Because like you say, you talk about the new normal thing you see on TV. And it is funny. I think anybody who's battled cancer would just like look at that as such a ridiculous statement, and honestly, like a little bit of a comical statement, because there really is like no. I'm a big believer that there is no normal out there for anybody. Like normal doesn't exist. Like what is normal is different for everybody.
Yeah.
So it's your life changes drastically, obviously, for sure.
Yeah.
And there's new challenge, new adversity to face, but we're still people going through life, battling challenge and finding the best parts of it and cherishing those parts as much as we can. So what is it that you find is like your main motivating driving force as you face these challenges in life? What is it that keeps you going?
Just real quick, that made a noise. I didn't know if you heard that. Okay. I would 100% say my tribe around me, and that extends, you know, first and foremost, my husband. You know, he gets to see what everybody else doesn't see. He has to go through what nobody else has to, you know. He has to watch the struggle. He has to be part of the struggle. And he is just amazing. And, you know, he tells me how beautiful, incredible, brave, strong I am every day, and believes it wholeheartedly, whether I don't. And I don't lie, you know. My mom, like I said, she lives next door, and you know, a lot of times she has to live in denial, because it's the times that I'm going through that, you know, like you know, like you say, there's always something, you know, just when you think, okay, you know, just had my back surgery, like, you know, we're going to have some downtime, and, you know, got through that, everything's okay. And, you know, then for the first time, you know, I have, you know, some abnormal, you know, squamous cells pop up on my pap smear last week. And so now I have to go to get a colposcopy and, you know, possible biopsies and stuff like that for that. And so, you know, it's like, okay, that's something I've never worried about. And then all of a sudden it's like, oh, okay, you know, here we go again. So, you know, especially for her, it's just another, you know, stab to, you know, mother's heart that, you know, and especially she lives next door, and, you know, the times that, you know, something happens that, you know, I can't get off the floor or something, and, you know, I have to call her, and she rushes down, and, you know, she's crying, and, you know, but she's always there. And, you know, just my friend Megan, I tell people a lot that she runs my life, because if I'm, you know, down for days and I have stuff to do, like, I take on too much, like the party yesterday, like I wasn't supposed to be involved, you know, it was supposed to be thrown for me. And, you know, here I am, you know, making 1,000 Rice Krispie treats and, you know, this and that and whatnot. And, you know, she just comes in and pushes me aside and takes over and is like, no, I'm doing this, go lay down. Like, you know, she just is amazing and takes on so much in her already busy life that she has. And again, my cancer tribe, and you know, I have a niece and nephew that are 4 and 2, and I just adore them beyond anything. I love them so much, and I get a FaceTime with them once a week, and, you know, they just Auntie Annie this and Auntie Annie that, and I just warms my heart. It's, you know, the highlight of my week every week. And of course my son is, you know, incredible, is doing amazing things out there, and I just think I'm so lucky to be surrounded by that keeps me going, as well as my medical team, because I would not be where I am today without them. They're incredible. They're part of my family, whether it's weird to them or not, I don't know, but I consider them part of my inner circle because they're just so intricate in everything I do, and all the weird things that go on with me that, are out of, the norm. So yeah, it's the people around me.
Yeah, I love that. And it's again, something that we hear very consistently on this show is that you do it for those loved ones around you, the people that help you fight, that help you survive, that sometimes literally keep you going.
And like this one.
Yeah.
He is definitely, a big part of, just having, I don't know, that cuddle and that, constant, he is at my heel 24/7 and he does not leave my side. And, he's pretty great to have too. Hi, Joe. Hey.
Yeah, we all love Joey. Sounds like he had a pretty big day yesterday too.
He did, yeah. He, he gets to do farm camp with Papaw every now and then, and it's a big deal. And he gets, I hear he was the parking attendant yesterday.
Oh yeah.
But he goes out and fixes fence and goes on a 4-wheeler ride and big tractor rides and all the things, and he loves it. Huh, bud?
Sounds like your relationship with your husband through this whole thing has just been one of the biggest rocks for you.
Yeah. And I think at a time that we were learning to be empty nesters, because we had just became that. And I think a lot of times that can be hard on a relationship. But for us, it was just, we had a good marriage already, and it just, built on that and grew tremendously, I think.
Yeah. Yeah, I think it's just one of those things you make it a daily commitment to choose to grow stronger together. And when you can face any challenge that arises with that sort of mentality and that sort of spirit and drive, it can build an impossibly strong bond and relationship and give you just a level of like respect and love for someone that you didn't even know you were capable of feeling.
Yeah.
I know we talked a little bit off camera that's definitely how I've felt about Lauren. It was some of the challenges we've had to face due to my cancer therapy that, have been truly impossible for us to go through together over the past couple years. And I mean, even outside of just some of the fertility pieces, it's like she's literally upstairs right now making me a few things that I'm able to eat, because all I can eat right now is meat, eggs, and cheese. And so we found some like creative things that I'm like able to eat, and like she just does that for me. And like I don't, she just does that for me. And she doesn't have to. She does, like she just does that. It's like it's amazing to me, and I'm just so thankful for it. And I know it's got to be hard to put into words, but what would you say to your husband? Like, just if you could say anything to him right now, just to like convey to him how much he's meant to you throughout this entire process, what would you say to him?
You're gonna make me cry again. I think that, and he and I have talked about this, as well, that, we were brought together kind of later in life, and I think everything happens for a reason, no matter, how good or bad that is, no matter if at that time, like, why do I have cancer, and those things. But I 100% think that we were brought together for a reason, and he knows that he's the love of my life, and he's my person, my everything, my rock, and I love him so much. And I admire his parents. You can see so much of them in him, and he's just, he's all the good things, from just, he's so patient and caring, and just everything, but at the same time, goofy, and like, he does little dances for me. If I'm in bed all day, he'll just kind of like walk in front of the bed and like stair step down, kind of shaking it, and I'm the weird one that, loves the smell of, his sweaty armpits when he comes home from work. And, I'll stick my face right in his armpits, which is so normal, for somebody just to, stick their face in your armpits because they think it smells good. So, we just have that relationship, where it's just, we can still make each other laugh and be ornery, and, but I love him more than anything in this world, and he's just everything to me. And I am eternally grateful for the patience and love and everything that he has given me, and not out of obligation, because he genuinely cries with me, feels with me, loves me wholeheartedly, and I feel the exact same for him.
That's incredible. And you've actually done something that I know I've told you repeatedly today. I'm so amazed by it, so impressed by it, because it's such an impossible thing. And you've actually very recently captured this entire journey, put it into words, put it on paper, and wrote and published a book of your journey. Could you tell us a little bit about what the book is, what the story holds, and like what that journey and process was like?
Yeah, so I it's actually kind of ironic because my chemo brain is so terrible that I can't focus on reading books anymore, and that's something I always love to do, and but I can't retain it and focus on it. And so it took me a while, but I taught myself how to focus on audiobooks, and so kind of turned it into that way. And I had listened to a book called Between Two Kingdoms, and I think she had lymphoma. I'm trying to think of her name. It's like Salika Jihad or something like that. Probably totally ruined that name, so maybe cut that out if that's totally not right. But anyway, and as I was reading her journey, she didn't have the same cancer, but she had similar experiences and treatment, like the stem cell transplant. And after I had read it, I remember calling Judy and being like I just listened to this book, and like, it's us. And it's such validation. I think that like, sometimes you think, gosh, like, is this just me? Like, am I the only one that had that experience through this treatment or whatever? And after I read it, I couldn't stop thinking about the book and the journey that she went through. And she had made so many connections through her journey. And then she went on this big road trip and met all these different lives of people going through different struggles, not necessarily cancer. And I just couldn't get it off my mind. And so I just sat down one day in February and started, have a hard time typing a lot. I have neuropathy in my hands, and I have, and feet, which I suppose circles back to daily living, but, the arthritis in my hands, I can't type, for very long or write. And I found out that you could talk to text on the iPad on Microsoft Word. And so I just started kind of going back through my journals, and I'm like, I'm going to put my story down, not necessarily knowing where it was going to go from there. I didn't tell anybody, even my husband. And I think that's the first time in years that I've kept something from him, which was hard, but it was something I needed to do for myself. Without any expectation at the end. And I just started writing it, and when I finished it, I finally told my husband, and he was like, oh my gosh, that's amazing. I can't wait to read it. Like, I'm so proud of you. I can't believe you did that, da da da. And then I sent a text to my group text for my cancer tribe, I call them. And they were just so supportive, I'm so proud of you, this is amazing, can't wait to read it. And then I told my brother. My brother has published a couple books, some way back in the day about his fraternity lifestyle, and then most recently a genealogy project of our father's side of the family. He did that. I think he started over COVID, and it's actually in the National Library of Congress right now. So that's something he's familiar with, and I didn't know what to do with it. And so I was like, okay, let's do this. Let's just publish it. And it became very therapeutic for me just to get it out. Even though it was in the journal, it was still sort of a different interpretation. And so I let a few people close to me read it, my mom, my brother, Megan, and, kind of tell me what they thought, if I needed to change anything. I am not a writer by trade at all. I'm more on the artistic side. I love everything crafty, artsy, and like I said, I'm not good putting things into words anymore. I have a hard time getting them from brain to mouth. And so I wasn't sure how it read, if it made sense to anybody else. And so they read it. A good friend of mine edited it for me, made the changes, and then I announced it on my transplant birthday last year, my 4th transplant birthday, and published it shortly thereafter. And I have gotten such amazing feedback. It was hard because, I think I've spent this whole journey of mine saying I'm fine. And, that's become sort of, the tagline, in my family and friends, she's fine, and in the book, it goes into depth of all of the hardships that I went through and continue to go through, as well as the caregivers and what they go through. And I am also in some support groups on Facebook, Multiple Myeloma, different ones. And I had put it on there, and people around the world, from different countries, and have reached out to me and thanked me and said, I read it, loved it, and thought, this is me, this is my journey, and gave it to their friends and family, because they too couldn't voice out to those people what they were really going through. one, to not, you always have that thing, you don't want to burden them with it, or you don't want to be repetitive and annoying with it, and so I'm fine is just the easy answer. And people were sharing them with friends and family to read so that those people could understand what their loved one is going through. And I'll wake up in the morning, and on those pages, somebody will put my book on there and say, you need, promote it. You need to read this book because, it's helped me heal, and it's helped me, share things that I was unable to do myself. And, publishing your own book, you don't make a lot of money from it. You set your own price, and, you have Amazon's price, and they take, the publisher takes a certain amount and whatnot. And, I do the bare minimum, and any, little bit I make, I donate in different ways to the Myeloma Foundation or different, things around the area or people that may need it. And, it just has really, for something that was so incredibly scary for me to do, share the bad times, and all the hard times, and actually put those out there, I think is just incredible feeling to see that it's helping people so much, because you kind of get in that routine where it's like, you're doing the same thing every day, like, what's my purpose? My son's in college, he doesn't need me, like he needed me before to do this and that, and like, you need purpose in life always. And if I can help people in any way, then, that's what I want to do. And, if my journey can help one person learn something, or like, there's little things in the book, that even my doctors didn't tell me. I found out through my support group, you have metal mouth when you have chemo most of the time, and it's awful. You don't want to eat. And somebody in my myeloma group, like 6 weeks into my cancer treatment, said, switch to plastic silverware. And, nobody had told me that, and it was amazing. And, that has actually been brought up, from the book. Like, I never knew that, and I did that, and, for my husband, and it's, he's eating again. And it's the little things like that, like you said, that, you learn from during your journey. And if you can share that and help somebody else, ease their uncomfortableness or, pain or, things like that, then, that's all you can hope for, is to not just in a cancer journey, but you always see everywhere now, be kind, because you don't know what anybody else is going through or struggling. And most people are in some way, shape or form. And, whether it's, I always try to, when you do something as simple as checking out at a grocery store, tell them to have a nice day, thank you, and be courteous. And, I just think that's the lifestyle that I want to live. I want to help people, and, be grateful for people, whether it's every single time I go to any doctor's appointment, no matter how I feel, or, I've recruited my mom and Megan sometimes when I'm physically unable to get up and bake like I like to do, for Strecker, because, they've come to kind of expect that they know when I'm coming in. And, sometimes, like I said, I'm not the one that's done it all, but I always like to take them, that timeout moment where they can have a sweet treat and take a break, even if it's just for a few minutes, because they're so busy and running around. And I try to do that.
Yeah, that's incredible. So what, I know you got a copy of the book with you today. What's the title of it?
Oh, I didn't get there, did
No,
I?
you're all good.
So it's called I'm Not Fine, but I'm Surviving Cancer. And, it kind of, the prologue starts out, at that last normal moment before everything changes. And then it goes through the whole journey of all the good and the bad, and and then the turning point to where I kind of learned how to take everything day by day, and to kind of when my cancer tribe came in the picture, and how that too was a turning point, and how, you can get through it. It sucks for a long time, but, you can get through it, and it gets better, and not to give up and fight, and, continue that battle as hard as it may be, and find the things that allow you to do that, and kind of escape that mindset for a little bit. And so, I know the book is a hard read for a lot of people, whether you've went through it or not, whether you're close to it or not. But then, my hope is that, at the end of the book, and I won't give away the ending, but that was hard for me. That was the hardest part. It took the longest time to come up with an ending, because my battle doesn't stop. My chemo doesn't stop. There isn't a cure yet. So how do I end it on a good note? Because it doesn't change. My life doesn't change. My daily routine doesn't change. The roller coaster doesn't stop. The things that pop up, like this whole, new situation, colposcopy thing that I have to deal with next month. Like, there's always something. But the ending is my favorite part, and I hope for everybody else that it is that the ending and that I decided to go with. There's like my dad, he still hasn't read it. He has a copy on his, coffee table, but it's too difficult for him to listen to, read through the bad times. Like I said, that previously, pretty much Sean has only witnessed. So I hope it continues to give people hope, and give other people understanding of what the people around you are actually going through, and maybe they're not fine, and maybe the littlest things, like just a text message saying, hey, I'm thinking about you today, do you need anything? They're going to most likely say no if they're like me, and but that still means something, that you get that, and that you're checking in, even though that you think they're okay, and you see a picture that they've photoshopped their chemo eyes and everything online, and they're actually in bed kind of suffering that day, and they get that text, and that may be the only thing somebody needs to brighten their day that day.
Yeah, that's incredible. So you guys can get this book, and I definitely recommend you guys check it out, because there's so much to learn in there beyond just what we cover in the podcast. You can get it, there's two different sites. You can get it on Amazon is one of them. So if you have an Amazon's, well, I guess you wouldn't even need a subscription. Anybody can order anything off Amazon. So we'll link both of those sites in the show notes. You guys can go directly there, whether you're watching through YouTube or listening on Spotify or iTunes or wherever you like to listen to podcasts. We will have those in the show notes. We'll be posting them on social media, but we definitely recommend you guys check out this book and learn more, not just about Leigh Ann's story, but how to survive. Because as we said earlier, a survivor is not just somebody who gets their cancer cured. A survivor is somebody who has the courage and the confidence and the strength to wake up every day and battle through whatever adversity, whatever impossible they may face in life. And Leigh Ann, we definitely know you are a survivor, as we've had so many on this show, and we will continue to have so many. I had just one final question I wanted to ask you, and just because truly I don't know the answer to this one myself. You use the butterflies a lot of imagery and symbolism for your journey and your fight. Where does the butterfly come from, and what does that mean to you?
It's just, I've always just loved butterflies. And like I said, my brother had, before he became a nurse practitioner, his first degree was in graphic design. And he, had these bracelets made and sent them to me, immediately right away. And which was really great because I posted them not as a fundraiser, just, hey, my brother sent me these, if you want one, let me know. And we had hundreds of people wanting them and wearing them. And actually, my best friend Megan's son, Sam, I call him my bonus son. He's 16. My husband, Sam, refused to take it off, and you're not allowed to wear it in basketball games. And he got into it with a ref that a couple years ago that he wasn't taking it off, and that his bonus mom has cancer, and he actually calls me dad, but and he wasn't taking it off, and he fought for it, and they didn't make him take it off. So and then my father-in-law, to this day, he still wears his, and my husband's never taken his off in 5 years. You can't read it anymore; it's blank, but he still has the original one on. So then my brother designed these shirts, and he just knew I loved butterflies, and so he designed the shirt, and all the butterflies on the back are supposed to represent my family, friends, my support system, and it says "No one fights alone." There's a bunch of butterflies on the back of the shirt. So that just became a thing, and there really isn't a big backstory to it. It's just something I've always loved and kind of, went with. And then when we did the tattoo, I just thought it was a really kind of neat thing of importance to celebrate every year and remind myself of, in the beginning, I knew nothing about this cancer. And like I said, I lost a friend on the same journey at the same time as me, and she only made it 2 years, 2 or 3 years, and it's just a reminder that you have to keep fighting, and keep adding those butterflies, and just keep going, fighting.
I love that, and it's another one of those moments we've talked about so many today, where it's like you just get this glimpse of things happening for maybe a reason, or having that significance or that meaning, whatever you could draw from that. But there's actually a butterfly on our bands that we've got that we did last year for the marathon, and the reason I had included that because we've got like the ribbon, the heart on fire, which is our logo. We've actually got Batman logo on there because that's awesome. My original one, like way back in the day when I was battling cancer. Then we've got the butterfly. We put that on there because that's actually the main logo for Nationwide Children's Hospital as well, which is who we raise money for. And that's been their logo for a long time. I think even before Nationwide signed on as the title sponsor. But the reason they do that is because that really is the symbol of everything they do there. They help kids going through impossible challenge, and they take them through, as hard as that challenge can be, that crucible that can be childhood illness, and they help them survive and go on and grow into these beautiful and amazing, strong, confident human beings that they're able to become. And that was consistently our message last year, the whole year, it was never about, hey, we're raising this money and this awareness so that kids will never battle cancer again, because, you know, as much as we hope that that is possible someday, right now, the reality is that there are kids who are going to be diagnosed with cancer every year.
Yeah.
And our message was more focused on, for those kids who have to battle this horrible disease, we want them to know that there is life in that disease and there is life beyond that disease. And they can go on to chase their passion and their purpose and live out every dream that they have for their life. And that they can survive. And I never really intended it at the time, but when I hear you describe it in that way, it's literally that butterfly kind of journey, you know. As hard as something like cancer is to battle, you know, and especially as a child, I think it's something that when you go through that level of challenge and find the strength that you build through going something like that, it opens you up to a whole new world of potential. And I think the butterfly is a perfect example of that. So I love that that's your symbol and your imagery, and I think you represent that so well in your own life.
I know that you and I both know Kayla Antle.
Yeah.
And their family is good friends with our families, and she was diagnosed, I think, a couple years after I was. I think she was 3 initially, and you know, you always, anybody with compassion and a heart looks at a child going through cancer and just can't imagine what they're going through. But you know, when you have cancer and you know the pain and the nausea and, you know, all of the things that you go through as an adult, and to even fathom your child or any other child going through that, and you have no control over it and you can't fix it. And you know, I just watched that little girl, and with such strength, and you know, to just go up there and put her arm out to get that IV in, and you know, go through all that treatment that she went through. And you know, I have a little girl that was there yesterday. She's 8, and she has so many health issues and surgeries that she's battled, and she is the sweetest child. She loves Joey. But she had to start Zometa. Have you ever taken Zometa?
I've not received it personally, but it's something we've administered a lot in the cancer center.
Yeah, and it is the most painful, you know, because it's to strengthen your bones, and so it you know, goes straight to every bone in your body from your skull to your toes, and it's such a bone pain that most people don't experience bone pain.
Is it like the Neulasta bone pain?
What's that?
So Neulasta is something Austin and I received. I would imagine it's maybe similar. It's what's called a growth factor, and it's like when you get chemo that knocks out your white count, it stimulates your bone marrow to create new.
Zarzio.
Yeah. It's that similar thing, but Neulasta is like a long-acting version of that, and it because it makes your bone marrow work at 10x the rate, it causes it to swell up massively inside of your bones, but obviously your bones can't expand, so it causes it's honestly the worst pain of cancer therapy. For I know both Austin and I feel that. It's something that like not even opioids cover up. So I would just wonder if it's maybe a similar type of pain.
Well, I had this, is it Zarzio?
Yeah, Zarzio's the
and
short-acting version of it.
You can get either one depending on which one your insurance covers.
There's Zarzio or Neupogen.
And I ended up having Neupogen before my stem cell transplant or harvest to get more stem cells. And Yeah, it's like they tell you you're going to have bone pain and it's going to suck. And, they tell you to take Claritin, which is, so bizarre. It's like, you take Claritin for bone pain, but that's like, I remember taking Oxy for it and it just not doing anything. And, when I found out, my friend's little girl had to have, and so eventually, with insurance, you have to try the ones that, are cheaper or have a, contract or however that works first before they'll let you do anything else. And so I had to do Zometa a couple times before switching to Xgeva, which was much better. So anyway, so this little girl who's 8, had to take the Zometa. And, I remember talking to my friend about it, and because she messaged me and said she's screaming in pain, do you know of anything? I know you've taken it. And I said, did they tell you to give her Claritin? And, which to me, for a children's hospital, you're giving something that is going to cause so much pain. My gosh, you should know, at least try that. Yeah, and I remember her messaging me a few days later and saying, thank you so much, because that was the only thing that allowed her to stop screaming and actually go to sleep for a little bit. And, so to watch these kids just go through so much pain and jabs and everything, knowing what they're feeling and probably in so much excess as a child, the strength and resilience of them is just incredible.
Yeah, I always tell people, because I had a childhood cancer, but I was 18 or just turned 18 when I had it, so I wasn't like a kid necessarily. I was still in high school, so I wasn't an adult either. I was in this kind of weird transition period, but I got to see a lot of young kids battle cancer. And in fact, that was the first thing that really got me to like snap to and be like, hey, you're going to fight this. Because as much shock as you're in when you're diagnosed with something like that, and as like sorry as you can feel for yourself for something like that, I always tell people, it's like, if you want to see real strength at its highest level, walk into a children's hospital, because there are kids there, young kids, babies, and they just don't know anything but to fight.
Yeah.
And to fight with a smile, and to fight with joy, and to live life and survive with everything they have within them. And if you haven't witnessed that, it is a truly magical thing.
Yeah, and I would so much love to, now that I've got my back surgery out of the way, I would so much love to be more of a part of your journey with that in some shape or form this year. I don't know what needs to be done or could be done, but I would love so much to be part of that journey.
Yeah. Well, I'm we would be obviously honored to have you as part of it, because you were such a strong, confident, capable person yourself, and you have survived so much, and you continue to survive every day. And I think you're just a shining example of exactly what it can be to battle through not just cancer, but any impossible challenge that anybody could face. And so that's the very core of what we do and what our message is. So we would be absolutely honored to have you as part of that journey. And there's actually, it's kind of perfect timing, because that's kind of how we close every podcast, is talking to people about, what can you do to be a part of this journey? And there's so much out there. I mean, the first and foremost thing that we always ask people to do is to just live this message in your own life. And if these stories help you, share them with somebody who's going through a tough time. And I would absolutely urge everybody to do that with this episode, because Leigh Ann has faced so many challenges, so much impossible in her life, and she's been able to build so much good and so much positivity out of it, that whether you know somebody who's faced multiple myeloma or a different type of cancer, or maybe not even cancer at all, there's something to be gained from this episode. And so if you guys know anybody that you can share this podcast with, please do that, because it helps spread this message to more people. But as far as joining Team Impossible for our fight to help inspire and motivate kids battling cancer and help show them the potential that awaits for them in their own life, we actually have a few different ways you can do that. We're going back to Columbus this year to run the Columbus Marathon again. We've got 36 now after this week people signed up for our team to run this year, most of whom have never run more than a mile in their life. And they're going to go run a marathon because they now believe that it's something they can do. And they want to show that same thing to kids who are battling through childhood cancer and other forms of childhood illness right now. So if any of you guys want to be a part of that journey in running a half or full marathon, you're more than welcome to join our team. We would love to have you. But even if you're not, comfortable running a marathon, or that's not something you want to chase right now, our main goal this year, last year, thanks to the help and support of so many people like you and so many others in this amazing community, we raised over $32,000 for Nationwide Children's Hospital.
It's incredible. For
kids battling cancer. Yeah, I'm just so thankful for it, because it just speaks volumes about the community we live in, and not just here locally, but everyone who helped out across the nation last year in helping us meet that goal. But this year we're actually taking a little different approach, and we're helping bring more children's champions to the Columbus Marathon than ever before. Mm-hmm. And what that is, so a children's champion is somebody who raises money for the hospital. It's done through the marathon, but you don't have to run any part of the marathon in order to do it. So they bring about 19,000 runners to the Columbus Marathon every year. And whenever you sign up to be a runner, you can sign up to be a children's champion as well, which basically just means that you become a champion for kids at Nationwide Children's Hospital. And they give you your own little website. You can sign up to be on a team of children's champions. We have a Team Impossible group of children's champions, and you can sign up to help raise money for kids. They give you your own link. You can post on any social media, and people can donate to kids through there. And each children's champion can decide where they want their money to go to within the health system. So whether that's cardiac or oncology or wherever it is, you can decide where that money goes. It all stays directly on campus. They have 3 giant research buildings where they're conducting life-saving and life-changing research every single day. Mm-hmm. And it all goes to benefit kids right there. But you can sign up to be a children's champion and be a part of our team, even if you're not running the marathon. They have a virtual option where basically you can just sign up to be a children's champion and help spread awareness and raise money for kids and help spread this message to them that they are strong, they are capable, they are survivors, and they can go on and chase their dreams in life. And even though there's 19,000 runners that show up every year, only about 600 people sign up to be a children's champion.
Really?
Yeah. So this year, we want to bring more than ever before, or ever have been brought before, to the Columbus Marathon. So if you guys, anyone listening, is interested in becoming a children's champion, you can sign up to be a part of Team Impossible. Like I say, you do not even have to run the marathon. And it costs $5 to sign up. That $5 goes directly, it's a donation directly to kids. So the foundation doesn't collect any of that. It all goes back to kids they're helping right there. But it is a $5 sign-up fee, I think, just for processing fees and things like that. But then you will be on our team, and you can help kids battle through these illnesses, and you can be a part of our movement to bring more children's champions to the Columbus Marathon than ever before. And here is why that is so important. These kids, as strong as they are, they're still kids. And they look up to heroes of their own in their life, you know, whether that's superheroes or, you know, their favorite princesses or whoever that is. These kids are constantly looking for heroes to show them what is possible. And their favorite heroes are their children's champions. And I'm not just saying that to say it. I'm saying it because it's true. Every year the marathon hosts a big luncheon, and we got to go to it last year, where all of their patient champions, they call them, so the kids who are stationed at every mile of the marathon, who are all patients that are actively getting treated at the hospital right now. The hospital brings these kids out and they give them the royal treatment. They do red carpet. They do a video shoot. They do a photo shoot. It's incredible what they do for these kids. But all of the people who are signed up to be children's champions can actually come out to this luncheon, and you get to meet the kids you are directly helping. And what's even more important than that is these kids get to meet you. And last year we got to meet so many of these kids, and we got to bring members of Team Impossible there, and they got to meet us, and we got to build relationships with them and their families. And there were a few different kids that we developed specifically close relationships with. You guys have heard me talk about Sam before on the podcast, who had the same type of cancer that I had, but he did not have to lose his leg thanks to efforts like this. But there was another kid named Bryce, and Bryce actually didn't have cancer. He battled a different childhood illness, but Bryce had battled it, you know, for a significant part of his life. And Bryce was a hockey player. He loved to play hockey. And so his whole crew and his whole family was all about getting out there. And they said they did stick taps for Bryce, which I guess in hockey is like something you do. Like, it's kind of like clapping, but you just kind of tap your stick on the ice and it creates that clapping kind of effect. So they brought a whole bunch of hockey sticks out to his mile, which was mile 9 of the Columbus Marathon. And they did a bunch of stick taps for Bryce. Well, by that point in the marathon, I was already struggling a long time before I got to mile 9 due to the health challenges I was battling. And but I knew that mile was on my list, on my like focus of like, I got to get here to see Bryce. And it's it had worked out that we were already passed by everybody. They were already shutting the course down ahead of us before we'd even gotten to that point. But we're running up this road, and we see the runners who had already finished. They're going back in the opposite direction, and they see our shirts on. They say Team Impossible, and they said, "Are you guys the Team Impossible people?" And we said, "Yeah." And they said, "Bryce is looking for you guys." Because we gotten to meet him at that luncheon. And I didn't even realize then the level of impact that we had on him. And it was due to nothing special about us. It was just simply the fact that he knew there was somebody out there fighting for him. And we were wearing one of his wristbands for the race, and it's kind of cool how it's set up. You know, we're coming up this road, and you go around this corner, and there's Bryce's mile station. And so I think because they were already shutting the course down, I think he and his family thought they missed us somehow, or that, you know, we'd already gone past, or that we didn't make it. There's, you know, whatever had happened. I think they, you know, had kind of thought, oh, they may not get to catch us. But we round this corner, and we see him and his whole family, and I just yell his name out as soon as I see him. And he turns around and he like freezes, and I see him off in the distance. I'm running up to him. By the time I get to him, he is just in tears. Oh. You know, it's like he's the kid that inspired me to do everything. But when I saw that, it was just right in front of me. It was a real world example of like what we mean and what we do, the impact it has on these kids. And the social media director of the foundation actually got a great picture of me and Bryce high-fiving as I run past him.
Oh, that's awesome.
Yeah. And it's one of my favorite pictures of the marathon, that picture and the picture of me and Sam, because it's just it represents exactly why we do what we do. Because the impact that you can have on these kids by becoming a children's champion, you become a hero for them. And in doing so, you give them a reason to keep fighting with the same strength that they've fought their already long journeys through. And so when you sign up to be a children's champion, you can help raise funds, yes, but it's so much bigger than that, because you spread awareness for childhood illness and those battling it, and you become a hero for these kids. And you help them become that like incredible butterfly that they can be in their own lives and whatever it is they choose to chase. So if you guys are interested in joining Team Impossible this year, that is the number one way you can help. Those links are also in the bio and in all of our show note descriptions, and you can share those links with anyone else. And if you guys need help getting set up or learning how you can get this sign up, you can reach out to us at impossibleperformance.com. We have a form on there you can email us through. I think our phone number is also posted on there. You can also reach out to us on social media. I'm at impossible.performance. Austin, brother, where can they find you at? Austin_strength. And Leigh Ann, if people want to follow you or learn more about your journey or keep up to date, what's the best way that they can do that?
I have a Facebook page for the book called I'm Not Fine, But I'm Surviving Cancer. That would probably be the best way. Instant Messenger, perfect. Anything like that. And I had already planned, like I was saying earlier, to donate. I donate, to several different places throughout the year since publishing the book. So anything I make this summer is going to go straight to the Impossible for Children's Cancer.
We really appreciate that.
As part of the Children's Champions. So yeah. I will be signing up for that and putting that money towards that and any other funds that I can get towards that. And I'd love to be a part of that.
Well, we're honored to have you as part of the team, because like I say, you live out every day of your life our message and what we mean when we say be impossible. So we're honored to have you as part of the team.
Thank you.
Did you have anything else, Leigh Ann, you wanted to leave people with?
I don't think so, and definitely not me personally. 'Cause I think it's hard to take those sort of compliments sometime, to yourself. You continue to say, that you're inspired by me, but, I just think that, the moment I met you, I think you create a connection, instantaneously through, going through the same journey, and just the presence that you give off and your motivation and everything you do. And I'm inspired by you every day and love what you guys are doing on Team Impossible.
We appreciate that. And, Austin and I would both say it is our honor to do everything we get to do.
And
it truly
so
is.
excited that everything is worked out for you right now, and hope that you continue a positive journey and stay in remission.
Yes. Hearing it once and then hearing it a second time certainly makes it a bit more difficult, but
yeah,
it strips away some of the hope, but ultimately just tells me that I need to continue working.
Yep.
So,
Yep.
and that's the best part.
Yep.
That's the best part.
Just keep fighting.
Absolutely. That's what it means to survive.
Yep.
Just keep fighting. So guys, thank you again, as always, for joining us on this episode. If you enjoyed this episode, then please like, comment, and subscribe to our show. And most importantly, as we always ask, please share this episode with someone you know who might need to hear it, or who you think it will have a positive impact on. Because as with all of the stories we bring onto this show, there's always an infinite number of lessons that you can pull from them in help with battling and fighting through the impossible in your life. And that is exactly what we are working to do at Impossible Performance. We are striving to build a global culture of strength, fostering a spirit of growth in constant pursuit of the impossible. Thank you guys for listening. And as always, be impossible. Thank you, Leah. We appreciate it.
Yeah, thank you. You guys are amazing.
We're just
What do you think, Joe?
honored to be here. It's like, man, I'm hungry.